And so we now proceed to the next debate on premature deaths from heart and circulatory disease. I call Dean Russell to move the motion.
Thank you, Madam Deputy Speaker. And I start this with something I never thought that I would be stood here discussing. At 47, as I shared in Prime Minister's Questions a few weeks ago, I shared that I'd had a heart attack. And whilst that happened back in August last year, I must admit it took several months for me to be able to feel comfortable talking about it more publicly, whilst I knew that I was on the path to full recovery, which I believe I feel that I now am. And as I said in Prime Minister's Questions, I feel a bit thinner for it. So that's, that feels a physical response to it. But one of the things that really came through, beyond the fantastic support at the NHS, which I will reference later, and friends and family and my team, was the support of the British Heart Foundation. Because their resources online and their support and their guidance was invaluable in helping me, when I was on my own, try and find a way through this in the path to recovery and understand the stories of others. So I wanted to hold this debate today, not just to share my own personal story, this isn't about me, but to hopefully raise awareness of the early symptoms, the early signs, some of the areas of prevention, but also some of the challenges that I'll be raising to the Minister for others who perhaps weren't as fortunate as I was around identifying the risks very early on, around the identification of the risks. So I will aim to cover as much as I can in the short time that we have. I know that others will want to speak in this debate, so I will not hog the time. But I'm hopeful that from this, even if just one person comes away from watching this debate, as I'm sure there are millions at home who are following this debate this afternoon, that even if just one of those might spot a sign for themselves or a family member or a friend and hopefully save their lives or change their lives. So start with, let's talk about the symptoms. Well, for me, and I appreciate they do differ for everybody in a slight way, and the British Heart Foundation has excellent examples and guidance for what these might be. For me, it started in my arm, and I felt a sort of numbness and a tingling sensation in my left arm, and an increasing tightness in my chest. And as that grew, it started to filter back to the back of my body. But it wasn't immediate. And I think, like so many others, often one thinks of a heart attack as a cardiac arrest, and that's where you literally stop and you need a defibrillator or CPR. Whereas with a heart attack, it can feel more like a slow process that happens quite quickly, if that makes sense. And so, as I started to get those symptoms, even for someone like me who had worked many, many years ago with the British Heart Foundation as a client of mine, where I worked on campaigns to talk about symptoms, even for someone like me who knew instinctively what was happening to me, even I thought, I don't want to phone 999, I don't want to waste their time. So I actually ended up calling 111, expecting them to say, don't be silly, take a pill, go to your GP tomorrow and we'll get you sorted out. And they didn't. The message I had back immediately was, an ambulance is on its way. At which point I thought this might be a bit serious. But even then, I was still in a little bit of denial about the situation. And I won't tell the full details of the story, but I was transferred very quickly to Watford General, where they saw me and were exemplary. The East of England Ambulance Service were absolutely incredible at the speed and the compassion and the support they gave me. Same at Watford General, a hospital I love dearly. And then I was transferred to Harefield Hospital, who again saw me very quickly. And I realised during that process the enormity of the situation I was in and the potential that I could lose my life. But the fact that I was unlikely to now because I was in the right place at the right time. Oh yes, please do.
The work of Harefield. My son has been in Harefield for 4 months. He had a heart transplant just before Christmas. So it's been a very traumatic, but I would just like to place on record the incredible support and care that they provide there. And also that we think of heart attacks and heart failure and conditions like that affecting probably people my age and maybe a bit younger and maybe a bit older. But actually, heart failure, heart conditions can affect young people as well. And that we mustn't have lazy diagnosis where people think just because somebody's young, they can't possibly have heart issues or cancer or other type issues. And so, but as I said, I just really wanted to put on record the great support that Harefield Hospital provide.
Well done. Hear, hear.
May I send my best wishes to the Honourable Member's son, and from my experience, he is in absolutely the right place, and I hope he has a swift recovery. And I echo the comments made that Harefield, the staff were just exemplary in every single stage of the process. And so I'd just like to just again put on record for my own benefit, rather selfishly, my gratitude to the East of England Ambulance Service, Watford General Hospital, Harefield Hospital, but also the cardiac rehabilitation teams, because the experience of being in hospital and having a heart attack was a matter of days, but actually it's a matter of months where you're going through the rehabilitation, the exercise programs, changing your diet, all of those things that are so important. So it's not so much that I can talk about saving my life, but it's changed my life. And I can't say that I was pleased that it happened, but I'm pleased it happened the way it did, if that makes sense, in terms of making a difference. But I recognise my experience is not unique, and however lucky I am in the experience I've had, and the subsequent opportunity to use the platform of Parliament to raise awareness of the conditions and the work of British Heart Foundation and the NHS, I think it just felt very apt to do this debate this month because it is World Heart Month. And it's an opportunity in these backbench debates to have these conversations and raise the concerns. And cardiovascular diseases include conditions that affect the heart and circulation, including high blood pressure, stroke, vascular dementia, and which I will refer to collectively in this debate as CVD. And over the last 6 decades, huge strides have been made in improving outcomes for those affected by CVD, with the annual number of deaths falling by around half since the 1960s, in part thanks to decades of medical and scientific breakthroughs. And that's where research is just so essential. However, today, I'm afraid, there are more than 7 million people living with heart and circulatory diseases in the UK, causing more than a quarter of all UK deaths. And in 2022 alone, over 39,000 people in England died prematurely of cardiovascular conditions. That's an average of 750 people per week. Just to give that a sense of scale, that's filling this chamber 2 times over. So despite the premature death rate for CVD continuing to fall by 11% between 2012 and 2019, sadly it still remains one of the UK's biggest killers. And I'm conscious that when speaking to the British Heart Foundation, they're doing a lot of work to raise awareness of concerns around waiting lists for heart tests and treatment going up, and we need to make sure that we tackle that head on. There's no room for manoeuvre in this. Let's keep moving forward to make a difference. And of course, more analysis is needed. From the life-saving research by, again, the British Heart Foundation, we know the causes of premature deaths from CVD are multifaceted and complex. I know that the NHS long-term care plan intends to look at many of these areas, but I really do call on the government to be bold, to look at coordinated action to address this issue through 3 ways: to prioritise heart care within the NHS, to accelerate vital care, to ensure better protection for heart disease by addressing the drivers and underlying health conditions such as obesity and smoking, and finally, create a research and development ecosystem for breakthroughs, treatments and cures. And I welcome the significant work already underway through the government's major condition strategy and the inclusion of cardiovascular disease in that. The interim report published last summer by the Department for Health and Social Care made clear the scale and urgency of the government's priority to address this issue. But I think urgency is absolutely key here. Around 80% of cases of CVD are attributed to modifiable risk factors such as high blood pressure, obesity, poor diet, smoking, making CVD largely preventable through a number of lifestyle choices. Now, I must say, for myself, politically, I'm not one that thinks the state should intervene and stop people from being able to enjoy their lives, but I think education is key to that. And education can come through many different means, but that includes engagement with the NHS and GPs to be able to provide advice. But it isn't about the state stopping people from making those lifestyle choices. But I think it's fair enough to let them know what those lifestyle choices might lead to that can make a big difference to them and their family. Nearly 2/3, around 64% of adults in the UK are overweight or living with obesity, and up to 8 million people have either undiagnosed or uncontrolled high blood pressure. Now, I admit, from my own personal experience, I knew I wasn't going to be running in the Olympics anytime soon. I can't exactly describe myself as an Adonis, but what I would say is that I did know I was slightly overweight, and I thought I'd be okay. I thought, actually, these things don't happen to somebody at 47. Like most of us, these things happen to somebody else, don't they? That's the way our minds work. And so this was a wake-up call for me, but that's why I want to make a wake-up call from this wonderful platform of the House of Commons chamber to others, that don't assume that it's all okay. Get checked out and make sure that you watch out for those signs. So I therefore welcome the government's ambition to halve childhood obesity by 2030 and help adults reach a healthier weight through a range of preventative measures to empower people to take control of their own health. And of course, for everybody, there's different ways of doing that. I won't share my own dietary ways, because I'm sure some dietitian will watch this and tell me that I've got it totally wrong. But I've lost about 2 stone in the past 4 or 5 months. And it hasn't been through fasting, or I appreciate the Prime Minister does his fast each week, so I won't comment. But it wasn't through a fad diet, as it were. It was just through small changes in lifestyle, small changes in the way that I live my life. And I must say, as a Member of Parliament, like most people, we work long hours. My father was a lorry driver. I'm very proud of the long hours that he did, the work that he did to bring up myself. And I look at the jobs that we all take, and this job here isn't particularly physical, but it's long hours, it's quite sedentary at times. And I think that's probably the same for a lot of people across the UK. So being mindful of that and going for a walk, going for a bit of exercise can make a big difference. And the long-term plan, of course, the NHS long-term plan, of course, sets out the government's determination to prevent 150,000 heart attacks, strokes and dementia cases over the course of 10 years. And I, of course, welcome the focus on early intervention to help people live longer, healthier lives. But we all know that within this, smoking is still the single leading behavioural cause of preventable death across this country. And so I'm very supportive of the government's desire for a smoke-free generation by 2030 and pushing forward with the tobacco and vapes bill to ensure that children under age 14 or younger, essentially anyone born on or after the 1st of April 2009, can never legally be sold tobacco products. And by addressing these lifestyle concerns and identifying underlying conditions earlier, it could help to prevent tens of thousands of heart attacks and strokes and support the government's ambition to improve healthy life expectancy by 5 years, by 2035. But actually, it's more than that. In my mind, it means that a child will grow up seeing their father or their mother. It means that somebody gets to see their loved one and their friends and their family into the age that they can call them a grandparent, or they can see them graduate. So this, for me, isn't just about government policy. This is about the impact on real people, the impact to help have someone have a positive life. And of course, when we talk about heart attacks in this way and heart disease and the issues being discussed today, we're talking about premature deaths. But actually, for most people who are affected, it's a restriction on their lives. And that's what I want to make sure that we improve for everyone across this country. So, of course, I'm proud to say that the UK continues to lead the way for medical research, establishing innovative new ways for early diagnosis and effective treatment. And at my own West Hertfordshire Teaching Hospital Trust in my constituency of Watford, which many will know in this place, I've campaigned very strongly to make sure we got all the funding for the new hospital, and that's a proud moment and very important. But one of the reasons why I was so supportive is because I saw the incredible work they did, in particular around virtual hospitals, and they've really led the way in showing that there are other ways to make sure we can support people's health, and especially with that being at home. And the idea of using technology and data to help improve people's lifestyles. And the beauty of the modern age is that many apps now have the ability to give you great guidance on your own health. People have got Apple Watches or Fitbits or whatever's out there. I don't want to sort of go down one particular brand route. But the reality is we're able now to track so much more of our health. But what I think we need more education on is what that data means. We can all see our heart rate, but what does that actually mean in terms of impacting people's lives? So that's where things like virtual care is so important. But I've long argued that we should be looking, and I won't go too far down this route, Madam Deputy Speaker, because it's a different debate, but I do think there's an argument for what I call, which is data donors. So at the moment, sadly, if somebody loses their life, they might donate an organ. But actually, if they could we could donate our data throughout our lifestyles, then we could actually use that so that the NHS and other organisations could start to say, could they cure cancer? Could they use that data in an anonymised way and with all the checks and balances to make sure that's done well? So I'm conscious of time, Madam Deputy Speaker, and I'm sure I'm going over my allocated period, but I just want to highlight that despite all the developments, CVD continues to have an impact on the wider economy, costing an estimated £21 billion annually in England alone. And as I say, behind every figure is a person or a family who've been deeply affected by these conditions. And as part of this process, I was fortunate to work with the House of Commons Chamber engagement team, and they reached out to constituents across the country to share their own experiences in preparation for this debate. And one respondent, and I believe this should be in the House of Commons library, if not, I'll make sure it's shared with colleagues and online, but one respondent highlighted this, and it really moved me. And they said that their daughter has half a working heart. She's had 2 open heart surgeries and will need another. If it hadn't been detected early, she wouldn't be with us today. That's a life, that's an ambition, that's a future that's still there because of the support that's been given. And I must say, I know I'm doing a bit of a plug for British Heart Foundation today, but one of the other comments which I thought was true of my experience was the British Heart Foundation has a brilliant website for facts, and the consultant team we are under at our local hospital in this instance are fantastic. There are many quotes from people giving very similar stories. The common concern, though, and I raised this to the Minister before coming to my closing remarks, and it was a common concern, was concern about aftercare following surgery or medical treatment and the effects of the condition it's had on them mentally and socially. I have to admit, from my own experience, one of the things that you suddenly start to feel all the time are twinges of things and thinking, is there something wrong with me? Is it happening again? My experience, within 2 weeks of having the heart attack, I'd promised that I would go to a local event, and I didn't want to let them down. And I remember going to it, and it was a searing hot day, and I remember genuinely being quite frightened about going out with the heat and with people, not knowing whether my body would still work the way that I hoped it would. And I'm glad I did it, because actually once I'd gone through that experience and being there and really realising I could still be me, I was able to actually overcome that, and I continued to work as best I could safely as I recovered. But not everybody gets that opportunity, and it's very easy when you've had a physical illness, and I think in particular when it affects your heart, is that you suddenly worry that you don't have that control over yourself and you don't know what might happen next. And I must admit, I've had many times where something's twinged and I've thought, is this it again? Thankfully, it hasn't been. But I think that aftercare is absolutely essential. You can fix the body, but actually helping support the mind through that process and the psychology is absolutely essential. And I know from colleagues in the House that they will have even far more powerful stories than mine of the experiences they've had, and I look forward to hearing that later. So it's about multidisciplinary care that doesn't end when the patient leaves the hospital, but it's about supporting their full recovery and also helping them with those lifestyle changes. And I have to admit, the cardiac rehabilitation team I worked with were phenomenal, because with some of the times when I was extremely concerned, they just put my mind at rest, and that meant that physically and mentally I was better. So I therefore asked the Minister if consideration would be given regarding potential counselling services and mental health support to those affected by heart and circulatory conditions. So as I have said, heart and circulatory diseases cause a quarter of all deaths in England, amounting to over 140,000 each year, 480 a day, or one death every 3 minutes. Madam Deputy Speaker, in the time that I have spoken today, sadly 5 people will have lost their lives, and therefore I call on urgent action to do more to protect our hearts. So by prioritising the right action and supercharging the progress that's being made on addressing heart and circulatory diseases, we can improve the nation's health, grow the economy, and give people hope for a brighter, healthier future. Thank you.